You know, at my facility, we've had a slew recently of kids that have been transferred to us who started off at other hospitals and then ended up having to come to us either because the physician at the outside hospital decided that they should, or because the parents, for whatever reason, weren't happy with the care that they were getting. And it got me thinking a little bit of why is there such a disconnect between what other hospitals do, no matter where they are. Doesn't matter if they're rural, in the city. But if you bring your child to a non pediatric specific facility, there's a few things that you probably need to understand. So, parents of pediatric patients, or even potential pediatric patients, this is what I'm going to tell you. You are welcome to bring any patient, your child, you can bring them to any facility. Lord knows we have adults that show up at my pediatric ER. We still see them. We'll still treat them to the best of our ability. But when an adult shows up at our shop, after we have done the stabilization that we can do and that we are allowed to do, whether that's based on the certifications of the doctors who are on duty, the rules of the hospital that we're at, we have to take those adult patients, we have to send them over to an adult specific facility. It's the exact same thing for the pediatric side of the house. Now, there are so many more adult specific facilities. There are so many more hospitals that don't specifically specialize in pediatrics. Matter of fact, depending on where you live, there's usually only one, sometimes two, in the entire state. So it's an unfortunate thing. It can be a very frustrating thing for parents, but it's simply a fact of life. Kids just don't make up that large of the patient population. So, because they don't make up a very large part of the population, that means that all of the specialists that handle everything pediatric are usually condensed down into one very small space. Now, does this mean that there are bad doctors at adult facilities? No, doesn't necessarily mean that at all. What it does mean is that the doctors at any facility outside of a pediatric specific one, they see more adults than they do kids. Some of them, they're not even technically certified to take care of kids. That's why they have to send them to us. Of all the patients that come and see hospitals every year, the amount that are pediatric patients that require actual hospitalization is a very, very small fraction. And again, it's not that there's bad doctors anywhere, they just don't see enough kids to get really comfortable with them. It's the same thing in any job. If whatever job that you did, if I took you out of that job and I allowed you to do that job one day out of every month, you would not be as good, competent, and efficient at your job compared to someone who I let do that job for 25 days every month. It's just not possible. So I tell you that to say this. I fully understand that sometimes, depending on where you live, depending on your scenario, your family situation, logistics, a whole host of things, it can be a right royal pain in the ass trying to get your child to a pediatric specific facility. However, here's what I'm going to tell you. More often than not, if they end up going to the hospital, they're going to get sent to a pediatric facility all the same. Why? Because if they don't, what that doctor who does not see a lot of kids is going to have to do is say, I am so confident that your child is fine that I'm willing to let you go home. The biggest thing is they just don't get enough repetitions with them. And that's okay. They don't have to have the repetitions with those kids because, to be frank, there's a reason why adult and pediatrics are split when it comes to physician level training. Now, on the nursing side of the house, it's much easier for us to switch between pediatrics and adults. Reason being is our scope of practice is significantly smaller. We can't do all the procedures that the doctors can, but more importantly, our job is not to diagnose and come up with a treatment plan. Our job is to implement the orders that our providers come up with. Now, this is certainly not to say that nurses don't have a say in treatment plans at all. In fact, I would argue that if you work at a really good shop and you maintain and if you develop and maintain good relationships with your providers, you will absolutely be part of the care plan. In fact, sometimes, and I have seen this before, doctors can sometimes get tunnel vision trying to figure out a specific diagnosis. And it can be the nurses who say, hey, can we do this, this, and this first? And then if they're good docs and if it's a reasonable request, more often than not, they'll just say, you know what? Yes, absolutely. Let's try that first. It is truly very rare that you find bad doctors and or providers. It is truly rare. But when it comes to kids, most physicians, most providers, no matter where they work, rural, urban, anything else, they just don't see enough of them to have that level of currency and competency that makes them comfortable with it so that they could discharge you from that facility. They're going to consult the pediatric specialist, and more often than not, they're just going to send you to the pediatric hospital so the pediatric specialist can take a look at your kid and say, oh, it's like, actually, you know what? They're fine. Or it's like, okay, yeah, this is something that you probably do need to come into the hospital for, but you know what? We see this all the time. So, should you take your kid to a non pediatric facility if they're sick? Sometimes. And more than likely, it just depends on what they're sick with. The parents of kiddos with a lot of issues, they tend to know just to come to us. And more often than not, I just end up telling most parents and kids, especially if they started off in another facility, I will tell them it's like, just come straight to us. You're cutting out a whole step there. Plus, you're just going straight for the people who their entire job is just to deal with pediatric patients. Food for thought.